Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining a Collegial Conversation with Diana Clark. Today, joining Diana is Dr. Josephine McNary. Dr. McNary is a board-certified general psychiatrist and founder of Cal Psychiatry, a psychiatry practice with over 15 psychiatrists in locations throughout California. She is also the host of Mind Stories, a podcast exploring various mental health treatment options that are available for someone in need. Diana and Dr. McNary's conversation today will touch on maternal mental health and the challenges that women experience with postpartum depression. Thank you so much, Dr. McNary, for joining us. I'll pass the conversation now over to Diana.
Thank you, Laura, and welcome, Dr. McNary.
Thank you. Yeah, thanks for having me.
You're welcome. As I explained in the pre-show, I'm just going to start out with a few questions, and then we'll see where our collegial conversation goes. I'm old enough to have heard, we're going to talk about maternal mental health, but let's even just start with the other side of that spectrum of postpartum depression. You hear women talking, you hear sort of euphemisms for baby blues, you hear all of that. When does something like that become what we would call a clinical depression? And how do we get there?
Right. Well, that's a good question. And I think there's a lot of different answers to that. But if you think about when you're thinking about intervention and when you decide to implement various interventions that we have in the mental health field, that might look different for different people, right? And so the way I think about postpartum depression, it is true. I mean, most mothers do experience some degree of mood shift in the postpartum period. There's a lot of hormonal changes going on, a lot of huge transitions in a woman and a man's life, as well as a lot of sleep disturbance that then exacerbate mood and anxiety symptoms. But the way I think about it is, are the individual mood or anxiety symptoms impairing their functioning and their ability? If you're talking about the postpartum period, mainly you're talking about the ability to adequately and appropriately care for their child. I think that sometimes it's hard to know when you have a first-time parent and they're like, I don't know if I'm doing this right. I don't know if I'm doing this to the best of my ability. But we kind of talk to them about, look, are you able to understand when you need help? Are you able to take care of the baby's basic needs? I think so. It's hard to really define exactly what postpartum depression is. I mean, you can go through the criteria of depression, talk about changes in sleep, which is kind of tricky because sleep is so disturbed in the postpartum period to begin with. Talk about feelings of low mood, disinterest in things, fatigue, feelings of guilt, all those things, which, you could experience in the postpartum period without having postpartum depression. But I think it's the combination of all the symptoms, the huge overview of, okay, how is this impairing someone's functioning and do they need help for that? So that was a long answer.
No, that's a great answer. And it was only in our conversation that I realized on what a continuum it must be, and I like when does it impair the functioning of ability to take care of the child or other life functioning. Question I have is, if a woman delivers a baby and struggles with postpartum depression, how often do you hear, yeah, I can bathe, I can get her fed, I can do all this, but I'm not doing the real connecting and the joy that I had anticipated with motherhood? That would be something that I wonder if you hear more frequently, even than I can't get out of bed.
Well, okay, so that brings up actually another really interesting discussion, and that has to do with expectation of new parenthood. And so when someone is pregnant or expecting a child, there's this idea that the moment that they have the baby or the baby is brought into their arms, they're going to feel this immense sense of connection and joy to that human being,
Yes.
right? Sometimes that happens, and sometimes that does not.
Yeah.
Does that necessarily mean they're depressed? No, it might not. It might mean that sometimes bonding with your new baby might take some time. And so, I've seen so many postpartum women at this point. I've been postpartum a few times myself. And, this idea of this expectation of you will love this child unconditionally from the moment it is born, I think is not always true. And it takes some time. I mean, when a baby is born, it has a lot of needs and it's very overwhelming. And I notice with my moms and, even friends and my experience with motherhood, it takes a little bit of time to kind of get in that rhythm and in that groove of really feeling like you have that bond. And so I do think there are these unrealistic expectations of what bonding is. And it sometimes actually is negative in a way in terms of how a mom might see themselves. And they think, oh, am I not a good mother because I don't feel so bonded with my child, right? Of course, you need to care for the child's basic needs. And there is a degree of bonding that then drives caring for that child. But I think a lot of moms really do beat themselves up about that sort of thing, about feeling that they need to be more connected. And it seems like that's something that comes with time.
Yeah, that makes sense. That makes sense.
Yeah. But with that said, yes, in postpartum depression, it does impair a mom's ability to bond. And so I'm not saying let's not worry about the bonding, but also what I guess I'm trying to say is let's be flexible with it and let's kind of understand that sometimes it doesn't happen exactly the way someone might expect it to as well.
So I would imagine, as somebody who works with women in that phase of conception, being pregnant and delivering and postpartum, that you're hearing a huge range of stories and experiences of ages, everything, right? And I do think the expectation that you're going to fall off a cliff in love 5 minutes after you have just endured a potentially really exhausting experience is unrealistic. Do you ever use Winnicott's good enough sort of philosophy?
Oh, yes, all of the time. Yes.
I survived with good enough theory. I really did. It was like, okay, this is good. This is good. I can't be perfect, and this is good for them.
Yeah, and I think a very common theme I see in postpartum moms is this guilt over how they should be as a parent, how they hope to be. And the reality is, I mean, they read all these parent books and, everyone is so different in their own temperament and their own personality. Their children have their own distinct personalities and temperament. And oftentimes it's really that good enough match between the parent's temperament and the child's temperament that really makes for a good bonded, sufficient connection between parent and child. And I think the idea of the good enough parent really speaks to the fact of you do the best you can, right? And hopefully that's good enough.
Right. And you pay for therapy if it's not. That was always my, I am going to be flawed as a mother. That is part of who I am. You will have to reckon with those flaws because that's part of being an adult.
Mm-hmm. Yeah.
And I'll pay for the therapy. That was sort of how I booked it.
Yeah. And there's so many ways to be a parent. Right. And I also think if you try so hard to be a parent that just doesn't come naturally to you, it's probably not going to work very well either.
Right.
Right.
So maternal mental health has got to, what are some of the strategies when a woman is struggling and has crossed into that continuum of, I don't want to function and can't function today? What are some of the strategies we use and treatments that we employ?
Well, I will answer that question, but I'll rewind a little bit before the baby is even born. And so the majority of postpartum depression cases, or the biggest risk factor for postpartum depression, has to do with untreated maternal anxiety or depression during pregnancy. And so I think it's very important to be
Excuse me,
very vigilant.
that just was a light bulb.
Mhm.
Because
Yeah.
I would imagine that people stop certain treatments during pregnancy.
Right. And that's a whole nother topic about treatment during pregnancy. But as a physician who works a lot with postpartum moms and pregnant moms, my goal is to have my patient to maximize their mental well-being during pregnancy. And if we're able to do that, then we'll be able to drastically to reduce the chances of them experiencing postpartum depression. And so it begins even before the baby is born. And I mean, I will say there are some cases of postpartum depression that come without any history of previous depressive episodes, without any history of mood symptoms during pregnancy. And so, of course, like you wouldn't have that intervention during pregnancy because it's not really on anybody's radar in a way. But the patients I see typically have had a history of postpartum depression with previous pregnancies. They have a history of anxiety or depression, and they see me because we need to talk about the risks and benefits associated with treatment during pregnancy to keep them well. And so the conversation really is, okay, let's get you well during pregnancy. Let's maintain your mental health. And then about 2 months before delivery, I really start talking seriously about postpartum plans. And the main thing I talk about has to do with the mom's self-care. So one, assuming that you're going to have sleep deprivation, how are we going to deal with that? And if we need to get you more support, which I hope we do get you more support, because I'd rather you sleep well in order to maximize your functioning during the day. What can we bring? What are the strategies that we could focus on to get you that help, right? If there are resources, can we get you a night nurse? Can we bring in family members to make sure that they take a few, like 1 or 2 nights or more a week in order to enable the mom to sleep? A big conversation has to do with breastfeeding. Of course, I understand there are plenty of benefits to breastfeeding, but I like to talk to a mom about, what happens if you can't breastfeed? What happens if the baby has problems latching? What happens if you have an issue with milk supply? What happens if you just can't tolerate waking up 4 times a night to breastfeed your child? Right. And you are so tired during the day, you start feeling more anxious, feeling more depressed because of that sleep deprivation. And so I like to at least paint that picture before delivery of how can we be flexible about breastfeeding? Because I think there's a lot of guilt and shame associated with moms who decide that they can't do it, or for some reason, they just, even if they want to do it, they just can't. It's not possible. And so we talk about, yes, there are benefits to breastfeeding, but it's okay. If we decide that not breastfeeding is actually the best option, that's okay too. And so I like to have that conversation. I like to, if there's a partner, I love to bring the partner in so we can all kind of talk about what ifs. And then that means that by the time of delivery, we're kind of have an understanding of what we might have in place if we haven't already put it in place. A lot of moms, if they have resources, we are like, okay, 2 months with a night nurse. That's, even if you don't need it, let's have it there. Other moms are like, I want to wait and see. At least we have names of people that they can call if they need to get that set up right away. And so we just try to have as many resources in place before the baby is born. And then once the baby is born, we just watch them closely. And a lot of my conversation with moms has to do with like, is this normal? Like, yeah, your mood is kind of low, or is it not normal? And sometimes that takes a little bit of time to tease out. And that's why I think it's really helpful for a new mom to have a specialist who works with this quite often to really be like, I think we are moving into the range of needing to make an intervention. And so what interventions could look like if they are not on medication, possibly starting medication. And the conversation has to do with exposure with breast milk, and we can talk all about that, discuss the risks and benefits, bring in the pediatrician to also kind of weigh in terms of thinking about, okay, is it safe to breastfeed? Is it not? In many cases, it is often decided that breastfeeding will continue. It's talking about, do we have a therapist that specializes in working with postpartum moms and couples? Can we bring them in to give you some support? Is it really just bringing in more support, like hiring extra help around the house? And so there's really a lot of things that we can talk about in terms of giving the mom support. I mean, in the very extreme cases, if the mom is having a lot of trouble with functioning. Their mood is very low. At UCLA, there's a great program for maternal wellness for new moms who basically it's an intensive program where you go during the day, you bring your infant, you stay with your child, but you have group therapy, you get intensive care. So, I mean, there are different levels of treatment. I think it just depends on the mom's need.
That's great to know about. That is because that's newer,
It is, yeah.
How recently would you say that women's maternal mental health has been examined as an issue in our country?
Well, I actually brings me back to my 100th episode on my podcast. I interviewed a mentor of mine, Dr. Vivian Burt, who is the founder of the Women's Life Clinic at UCLA. And I forgot the year that she started this clinic, but decades ago at this point, really focusing on the needs of pregnancy, treatment during pregnancy, monitoring in the postpartum period. But that actually, the field of women's reproductive mental health starts even before that. So anything related to mood shifts that might occur during a women's kind of reproductive lifespan. So that might include PMDD, which is premenstrual dysphoric disorder, for infertility issues, pregnancy, postpartum, menopausal issues. And so it really does span the lifespan in terms of a lot of the topics that the specialty covers. But I mean, of course, I think over time it's gaining more and more interest. And when I was a resident in the Women's Life Clinic at UCLA 15 years ago, the intensive program did not exist for moms, and now it does. And it's so amazing that that resource is there for moms who need it. So yeah, I think there's just more. May
it move in the direction east across the country, and we can have.
There are programs throughout the United States, and so yeah, I think there's a lot more interest and desire to really shed light on this vulnerable time in a woman's life.
Yes. So I have one more question, which is, in our changing culture of what I like to now look at isolation from generations who once came in and took care of moms, do you think that is exacerbating the postpartum situation in our culture? I hear about it more, or is it always been there and I'm just now hearing?
Are you meaning to ask about kind of support and how it's different, how it's changed, and that families maybe aren't as
intergenerational?
Intergenerational. When you ask that, I think about in some Asian cultures, there's this tradition of mom staying home for a month and not leaving the house. And there's a lot of family that comes in and help take care of them. And, I love hearing about that model because it really is about caring for the mom, right? Making sure that they're cared for, limiting stress, allowing them to focus on the baby, but also having other people around to help. I think our culture is changed so much. And I mean, you think about that during COVID, all the new moms during COVID, and how hard that must have been in terms of not being able to bring in the help that they had hoped for. And so I just, my heart goes out to those new moms who had to deal with having a new baby during kind of the time of COVID and not having a partner in the delivery room with them. I mean, so many difficult things that moms had to deal with. It's kind of a rude awakening, or a shock to the system in terms of an introduction to parenting, because parenting is hard, right? And
how you're going to do it all alone, and you don't know what you're doing, right?
So hard, yeah. But yes, I mean, I think kind of going back to this idea of when I counsel my pregnant moms, it's like, how do we build up your support? How do we give you the care and need that you deserve? And so that looks different for different people, right? And I also want to make sure I address dad's needs too, because it's not just moms, right?
But the episode was about maternal.
I know.
So,
But I will say, like, there's such thing as like paternal postpartum depression too. And so I think it's just this idea, yes, with women having a child, a lot of hormonal shifts that happen, but it's also this idea of just a huge transition in someone's life. And times of transition are times of high risk for emergence of mood and anxiety disorders.
And other behavioral health disorders. I will show that in. Yeah.
Yeah.
Well, anything I didn't ask you that you want our audience to know today?
That's a good question. I often ask my guests that question, and I'm like, am I putting them on the spot? But no, I think it's a really helpful thing. I think we went over almost everything. I mean, I could talk about this for days, but I think maybe just last thoughts, to leave the listener with has to do with, just compassion of this is a difficult time. And a joyous time, but also a difficult time. And it can be hard and wonderful at the same time. And I think a lot of moms, maybe there's some shame around reaching out and admitting that they're struggling. And I think part of this kind of movement of making like postpartum depression in the press a little bit more, there's more discussion about it, is kind of normalizing it and saying, there are ways to help and there are things that you can do to get help. And I often talk to my colleagues who also work with in the maternal mental health space. And we always talk about how much we love working with this population because they get better. And not that other people don't get better, but
I know what you're saying. Yeah. Not just get better. They have the capacity then to fall in love in ways they didn't know that they were going to be able to. I mean, you get to see miracles in that way.
Totally. Yeah. And it's so great to see women. Yes, you struggle in this period, but you kind of grow into it and you kind of understand. It's a process of learning more about yourself. And every mom, I will say, 99% of the moms that I've seen that have gone through postpartum depression come out on the other end with so much more insight and understanding and self-compassion.
Yes, absolutely. Yeah. Well, thank you for joining me today. I appreciate the conversation. And I will send it to every new mom out there. I appreciate it.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.